Hi, I'm Dr. Roger Levin, Chairman and CEO of Levin Group, the leading and largest dental practice management consulting firm. For the last 6 months, I've been doing a lot of research on a new book called New Rules for Increasing Practice Production. This rule that I'm going to tell you about, I've been covering in seminars for quite some time. I give about 100 seminars a year, and in the business management seminars, they're high content, they're serious, we want to increase production, but we try to have a little bit of fun as well. And one of the fun moments is when I ask the audience how they feel about late patients. So the rule is, you want to fit in your late patients. You want to see them, and you want to take out the emotion. And when I ask the audience, how do you feel about late patients, I get a huge groan, especially from the front desk people. Late patients represent headaches, problems, you don't really want to see them, they make you feel like you're going to run late or get out late at the end of the day. Lots of people react very negatively to the late patient. I get it. I'm a dentist, and I was also in practice for 10 years full-time as well, so I am one of you. But what I then explain to them that in a moment, like a magic trick, they're going to love late patients, and they look at me like I have 3 heads. But what I explain is that 81% of dental appointments are single tooth treatment in general practice, according to the Levin Group Data Center. So if 81% of dental appointments are single tooth treatment, we know that's the majority of what we do. I then ask the audience, can any dentist name a single tooth procedure where if you have a no-show by the patient, they don't come in for one of the appointments, you don't lose money? Not a single dentist has ever challenged me and said, yes, if we do this, we won't lose money. I may be wrong, by the way. I just can't think of any single tooth procedure where you don't lose money if you have a no-show. Okay, back to the late patient. The patient comes in late. If we don't see them or send them home, they become a no-show, we lose money. So the fun quote that I use in the seminars is, you should love late patients because at least they're not a no-show. And then I tease the front desk group and say, go to your dentist on the next late patient and say, Mrs. Jones is late. I can send her home and we'll lose money, or we can fit her in. Which would you like to do? Well, every front desk person knows the dentist is going to say fit them in, and that's what's best for the practice. Now, to end, most late patients are one-time offenders. They're not the regular habitual offenders. So don't waste your time and emotion being mad at them. Fit them in, don't lose money, and let's go. There is a group of habitually late patients, and I want to throw this in here, and we know who they are. Front desk people always know who they are, and those folks should be scheduled 20 minutes early for all their future appointments. The downside is that the first time you schedule them 20 minutes early, they will be 20 minutes early for the 20 minutes early. And that's just the way it goes. But late patients, fit them in.